Welcome back. Congress is headed back to Washington after a week-long recess. They are back to work tomorrow. The White House and Senate Republican leaders are planning to turn up the pressure on lawmakers still not sold on the GOP health care bill. This as Majority Leader Mitch McConnell says he's not sure his party will, in fact, reach a consensus. Let's bring in Wyoming Senator John Barrasso right now, chairman of the Senate Republican Policy Committee. And Mr. Chairman, it's good to have you on the program again, and welcome back.
Maria, thanks for coming to Casper, Wyoming on a beautiful Sunday morning. Thank you.
Beautiful Sunday morning, it sure is. Okay, what is holding back a vote at this point, Senator?
Well, we're still trying to get to 50. We're working with all of the members of the Republican conference. We know it's not going to be easy, but it's critically important that we get it done. The pain of Obamacare is getting worse and worse. You've seen the headlines. Another Obamacare rate shock. The American people deserve much better. This isn't about politics. This is about health care.
You're absolutely right, and the American people understand that Obamacare is imploding. So let's put that aside for a moment. What I think our viewers really want to understand is why we're not seeing the bill brought to the floor for a vote out of the Senate. People want to see the agenda move forward and progress in health care so that you can move on to tax reform. So can you go through what really are the sticking points and where the debate is? I know there's a real debate in terms of the Medicaid expansion.
Yes, because we all agree we want to eliminate all the mandates that Washington has put on the people. We all agree we want to get rid of the taxes that raise the cost. We all agree we want to lower premiums, and even the CBO says we're lowering premiums by 30%. We want to make sure we're doing everything we can possibly do to lower premiums that makes it easier for more people to have coverage and more people to get insurance. You're right about Medicaid. You know, I'm a doctor, practiced here in Casper for 25 years, took care of every Medicaid patient. Medicaid was set up as a safety net for low-income women, for children, for people with disabilities. Obamacare used Medicaid as a dumping ground for able-bodied, working-age individuals, and that was not the intention. I want to protect and preserve Medicaid for those most vulnerable. But in states that expanded Medicaid, those folks are saying, well, we don't want it to be lost to any of those people who are now dumped onto Medicaid, but it's not working in those states either. So that is an area of concern. And I want to get the decisions back to the states. I always felt that if the states had more authority than the federal government, we could do much more with the same amount of money. I saw that in the state Senate. We want to make sure everybody with a pre-existing condition is protected, and of course people up to age 26 will stay on their parents' plans.
So it's really misleading then to say, oh, the Senate bill is going to knock out all these people on Medicaid who really need Medicaid, because what you're saying is there's a lot of fraud and abuse in Medicaid, and over the Obama administration, the Medicaid program had been expanded so much to include working, able individuals who really don't need the government assistance. Is that what you're saying?
Well, I'm also saying that the Obama administration paid bonus points to states to say sign up these able-bodied working-age individuals, but it didn't help the people it was initially intended to help, which were the low-income women, the children, and the people with disabilities. That's what Medicaid was put there for. I want to get back to that and put Medicaid to make sure it's there for these people who are most vulnerable, who it was intended for. But additionally, we want to lower premiums for everyone. You have seen skyrocketing premiums. They've doubled across the country in the last 4 years under Obamacare. We want people to have more choices. Maria, here in Wyoming, we're down to one group selling insurance. That's not a marketplace, it's a monopoly. There are places all around the country where no one is willing to sell Obamacare insurance. So as the Democrats had promised covering people with pre-existing conditions, Maria, if no one is selling insurance in those many counties, people are going to be left out in the cold, which is a result of the crashing Obamacare. It's a bus that's going over a cliff. It's crashing. We're trying to rescue people who are on this bus. The Democrats are saying, hey, just stay on the bus.
So what's the debate then? I mean, among Republicans, you know, if we all understand that Medicaid has expanded so much, that there's so much fraud there, what's the debate? Why can't your colleagues come together on this? Are you just arguing or debating how much to cut back Medicaid? I mean, what is, people want to see this health care bill come to the floor for a vote. Do you think you're going to do it before the August recess?
Yeah, absolutely. We need to do it. There's an urgency, Maria, to getting it done for the American people because Obamacare is so unstable. With regard to Medicaid, there are 20 Republican Medicaid. There are 20 Republican senators in states that expanded Medicaid. They want to make sure that they're treated fairly as a slow change in that. For those of us who did the responsible thing, didn't expand Medicaid, we want to make sure that our people are taken care of as well.
I understand. Do you think that you're going to have the same kind of debate when it comes to tax reform, Senator? Because I know that there's a lot of debate there as well. What deductions to keep in there? What should the corporate rate be? You know, border adjustment tax. Are you going to go down to the wire on this as well? Will you get this done in 2017?
Yeah, I believe we will. With regard to tax reform, to me it seems you need it simpler and you need lower tax rates. So we need to get that done. We campaigned and promised the American people we would repeal and replace Obamacare, we would do tax reform, we would do infrastructure, and then regulatory reform. The president is committed to that. I'm committed to that. The Republican members of the Senate are committed to that. We know we have an obligation as a result of our promises to get this done for the American people.
Right. But you don't have any Democratic support, right? You're not going to get any Democratic votes, so you've got to come together as a party, and you're still debating.
Because the Democrats are very clear. They like the mandate. They like the taxes.
Right.
They like Washington control over health care. Republicans are united against those things. We may want to make sure we're doing everything we can possibly do to lower insurance premiums for the American people, to protect people with pre-existing condition, and to protect Medicaid for the most vulnerable. That's what we need to do, get decisions out of Washington back to the states where it's much, much better, much closer to folks back home. It's what I've heard about this whole last week, traveling around Wyoming, talking to doctors, patients, as well as nurses.
I bet. Senator, we'll be watching. We will certainly be interested in the developments. Thanks so much for joining us this morning. Senator
Thanks,
Barrasso.
Maria. Thanks for coming to Casper, Wyoming. Thank you.
Thank you. The future of the GOP health care bill may be up in the air, but House Speaker Paul Ryan says that will not jeopardize tax reform. We're taking a look at taxes with Grover Norquist. Other side of this break. Back in a minute.